anybody is thinking about doing it for any reason, it is so worth it to change that I've gone through. For some reason, it went real fast for me. It still was 60 sessions, but the depression, within 8 weeks, I was starting to notice I had a voice. I started saying what was on my mind instead of always saying, okay, I'll do it for you. Even though I was like, yeah, like I have time to do that. So many things changed with the neurofeedback. The amount of medications that I was on, I take nothing. I don't even take the sleeping pills anymore. The sleeping pills were every night with 2 bottles of wine. That was my nightly thing, and don't even do that anymore. I don't take any of my antidepressants anymore. Life is totally changed. I still don't understand it, how I could sit there and watch How to Train a Dragon week after week, because it's a series, and walk out of there feeling great. I mean, I wanted something lighthearted, something I could laugh to. And it amazed me to actually sit there and watch a TV show and laugh.
Hey Sue, did it hurt?
Oh God, no. No.
How soon did you say you started to see results?
At the 8th session. Felt good, was happy. I went through, and I don't mean to be a Debbie Downer, but I went through my father passing through this, and I was able to accept that and know that he was in a good place, where I think if I wasn't doing this, I'd have been just totally a wreck. So yeah, for me it happened rather quickly, and they were surprised.
So Tom, what are the biggest differences that you've noticed in Sue?
I think the biggest one is that she really expresses herself well now. She used to hold everything in and not express her feelings or tell people what was bothering her, and that's not a problem anymore.
Thank you so much for sharing with us.
Thank you, Sue.
It's really big for me to actually be standing up here talking.
Yes.
Honestly, if it wasn't for Matthew, I would not be here. PTSD upended my life in a huge, huge way. And I went through a lot of things. I tried a lot of different, I did cognitive brain therapy, which is what the neuropsych doctor recommended for PTSD. I did it for 4 years and I felt somewhat better. I changed my diet. I did a lot of things. But Matthew asked me to come and speak, and because of Matthew, I'm here today and speaking. And what he didn't know, within 2 weeks, I was reporting that I was feeling better. And actually, it corresponds to Sue. Was it Sue?
Sue.
Yeah, 4 sessions. The neurofeedback is really helping me. I'm not crying, I'm not upset, I'm totally fine. It was the most amazing thing. And the second thing that we talked about was my leg. As you can see, I have a broken leg. And I didn't cry. It hurt like heck. It was swollen. I didn't cry at all until the doctor said, stay off your foot for a few days. And I got tears in my eyes because I said, I'm doing neurofeedback for PTSD and I cannot miss my appointment. So I just also want to mention in my gratitude journal that I noticed, and I hadn't really noticed it until I went back and looked, that Matthew was in there almost every single day that I went for an appointment. He is a special person. He listens with a deep heart. He doesn't judge what kind of day you're having. And he is just completely present, which nowadays is a rare quality. And so if anybody knows anybody that's struggling with PTSD especially, I really would suggest that you have him see Matthew. He's a wonderful human being, and I'm proud to know it.
So now I have the star of the show. Matthew is going to talk to you guys about neurofeedback. If you have any questions, please do not hesitate to ask. No question is a dumb question, I promise you. This is new for a lot of people. It's an amazing, amazing thing. And just a little background on Matthew. He graduated from ECU. He was enrolled in the Brody School of Medicine, and he was going to be a neurosurgeon. He found out in his senior year that he had epilepsy because a primary doctor prescribed him a medication without any testing or anything, which then woke up his epilepsy, and he cannot be a surgeon now because of the epilepsy. So Matthew changed his focus and went into still working on the brain, but with the neuroscience, doing the neurofeedback. He's also got a minor in psychology, so it's amazing what he can do with you in that room, because a lot of times you need your neurofeedback person and a psychiatrist.
Hi, I'm Matthew. Thank you everybody for coming out tonight. I appreciate it. Alright, so to start this process, the first thing we do is a mapping. So the EEG mapping gives us a reading of your 4 brain waves, your alpha, your delta, your beta, and your theta. These 4 brain waves are pretty vital in everyday life. What typically is going on in someone who's having an issue, ADHD, anxiety, depression, is that these brain waves are out of balance. Them being out of balance is most likely causing these issues. So what I try to do is help create these and make these brain waves come into balance, relieving you of these issues. You start by wearing this cap. This cap gets put on your head. I put in some conductive gel, and it helps read your brain. As you see right here, they're pretty stagnant. That's because no one's hooked up. However, to start is your green. This is your delta brainwave. That's your deep sleep. The deep sleep typically is very slow in frequency but high in power, which means that if your deep sleep brainwave can interfere with your other brainwaves. As we move closer to this 5, we get into the blue-green. That's your theta. Your theta is known as your subconscious, your dream state. So as you see, we're kind of going from sleeping and starting to get out of sleeping. Now we're going to the purple. That's your alpha. Your alpha is your relaxation, your meditative state. This meditative state is exactly what Brittany was talking about wherever she is. It's what you use during yoga. Some people were able to manipulate this brainwave to help them change the course of their life through meditation. As we keep going, right here in your pinks and reds are your beta. That's what everyone's in right now, your awake state. The beta is pretty vital. So as I said before, because that delta is high powered, typically your beta isn't, which is why there can be interference when there's out of balance. So just like everything, we don't want to cut our grass uneven, we don't cut our hairs uneven, we want to keep everything the same. So once we get this reading, I get a report. It takes me about 2 days to go over the report. What this report can tell me is the more areas that show up irregular, the more I know, okay, ADHD shows here, and it shows there. The more times it pops up, the more likely you are to have that symptom. Typically, when they come back for the report of findings, we see that that's the case. The EEG and the person are pretty much on the same page. So I do like to do 2 mappings. I like to do 2 mappings because during the week for adults or children, you're either at school or work, known as your active state. All day you have to be thinking, moving around, doing something. On the weekend, however, most of the time you get to go to the beach, relax, watch a movie. Your rest state. I like to take 2 mappings because I want to see what's happening in your active and your rest. Knowing what's happening in both, when I cross them over, I can pick out the high points, and I know this is most likely a serious problem because it's occurring both times. With that being said, does anyone have any questions about the mapping?
So for ADHD, what does that look more like? There's more delta activity?
So for ADHD, there would be typically high delta and low beta. It could be both. It could be one or the other. That just depends. On the report, I have 5 colors. I have a dark blue, which would be very low, a light blue, which is low, green, which is normal, whatever everybody perceives their normal as. Red is high, and yellow is very high. So on the report, when I get it back, I get a little brain. It says delta under it. It shows 10 little circles about each region. On the cap, there's different regions. Your frontal, central, temporal, parietal, occipital. Each of those regions we localize and check. So when I get the report on that delta, most likely if they have ADHD, I'll see red and yellow. I'll say, okay, this is the first sign. As I keep reading, there's your theta, your alpha, and your beta. Most of the time, your beta will be at the low blue. So these just kind of give us an average in that minute. When we see the actual report, it gives us, okay, yes, they were high in this area. Okay, they are low in this area. The brain mapping is a total of 12 minutes. 6 minutes with your eyes open, 6 minutes with your eyes closed. So each minute, as you see, it stops, and we're right here at 2 minutes. Each minute is where I change the localization for your brain. So at the first minute, we're reading your frontals. Second minute, it's reading your centrals, and so on and so forth. Typically, children have higher power than adults because they're still growing.
What do you mean? Oh, what do you mean higher power?
So you see how those lines right now are pretty low in the black space?
Right.
A child, those lines will be bouncing and hitting the top because they're still growing and their mind's racing. They're thinking about 100 different things at once. Where adults are pretty much more focused. So we'll usually see the green and the blue touch the top, and then it trends downwards because they're not as high as power. Why do you need your eyes closed? Well, according to your life, you're going to be sleeping. When you close your eyes, some people get anxiety because they don't know what's around them. So you close your eyes to see how you are with your eyes closed, because some people have anxiety with the dark. First, your eyes open, when they can see everything, they usually calm down. All right, I'm going to have one of my patient's brothers come up and speak with his mother, potentially. So his name is Brody, and he's going to take the floor.
Hi, so my
Let's speak
brother,
up.
so my brother, he was one of the patients.
I got it.
He was one of the patients of Matthew, and he had high ADHD and autism, not severe, but enough to where it affected us. So he was like very attached to electronics and things like that, like most kids today. But he would be like in a defensive state whenever his electronics are at stake. Like if he were to get his electronics taken away, he would scream, lash out, call people names, and he would start crying and destroying things. And
How is he now?
Brock is now he's a lot better. He now doesn't lash out as bad as he used to. Most of the time it'll just be like, "Aww," and then that will be about it. And
Do you find that you think your brother is a nicer person?
yes, I do think that he's a nicer person. He used to also have social anxiety. Like he didn't know what to do when people were asking him something. He had little social problems, and when people would like make a mean comment about him, he would punch them instead of thinking, well, if I punch this person, I will probably get sent to the principal's office. And he would more act before he thought. He wouldn't be. I don't know.
His reasoning skills.
Yeah, his reasoning skills. His reasoning skills, he didn't have much of them. But now he was there for the bus from one of the incidents that happened. Basically what he does is he acts more what his decision is. It's like if he does something weird that people think is weird but he doesn't think is weird, he'll just be like, hey, back off, it's nothing to laugh about, it's something of my own. And he'll stand for himself more than follow the crowd.
Good.
How old is your brother?
He's 9. His birthday was 2 days ago.
Brittany, do you have anything to say? Thank you, Brody.
Thank you.
Nice job, Brody.
Just adding on to what Brody said, he like one of the biggest things is that they are actually friends. They were not friends before. But we were literally in like crisis mode, and we had tried everything and spent thousands of dollars. And this has literally changed our entire family, our entire life. And we almost didn't do it because we had spent so much money that we didn't know that if anything was going to help him. And out of all that, this is the only thing that's ever helped him. And I would do it 1,000 times over if I had to.
So you need to come at least twice a week. It's like going to the gym. You gotta come at least twice. I like to start with about 3 or 4 times a week. I like to start with a little bit more because it does take your brain. It's harder for your brain to understand if you reduce how many you're starting with. So usually after about 6, if we're pushing it, you may feel a little tired. You may not. You could feel bad. You may feel great. However, because this is a process, you will have ups and downs. I have seen people hit rock bottom the first 10 sessions telling me, like, what have you done to me? They have to just sit back and wait. And then all of a sudden, 2 days later, they're jumping around like a little bunny rabbit. They are just so spruce, it's incredible. And they tell me every single time, I felt it hit me, and then I felt it release from me, and all of a sudden I feel great. And that feeling has to be quite amazing once you're feeling down and you pull yourself back up. So the training works basically the same way we train a dog. Apparent conditioning. So the dog pees outside, you say, good dog, you give it a treat. The dog pees inside, you ignore it. So that's kind of what we did. This would be what I'm looking at on my end, which is the training screen. On your end, you have one of 2 options. If your eyes are opened in your training, then you get to watch TV. The only thing you can't watch is horror, and you can't watch real life violence like Lone Survivor or American Sniper. The Incredibles, because it's cartoon, you're able to watch that. Now if you had eyes closed, you listen to music. With the music, the way you get your training is by audible. So as you hear the music and it's very loud, that means that your brainwave is doing what we want. So I'm going to use ADHD as an example since that's what it seems like we're mostly talking about here. So let's say high delta. If the delta is high, the patient would come in, we would train to lower their delta. If they had their eyes closed, as the delta brainwave was going up, going high where we don't want, that music goes to a 0. You can't hear it. Your brain does not like that because typically you're enjoying what you're listening to. So what it does is it auto-corrects that delta brainwave and it starts to work down. The moment it recognizes that your brainwave is starting to move down, that volume goes up and it gives it a reward. That reward is how we consistently habituate the learning process. With your eyes open, however, we have a screen. And as you see right there is our screen. This goes over the TV show, movie you're watching. As you're watching and your brainwave's going once again high, it's probably going to be dark like this because it's going away from where we want it to. So it takes away that stimulus you want of watching the TV. Now as your brainwave starts to become better and move down, it brightens. That brightening is the reward system. That reward system is what your brain loves. Your brain wants to do what it's meant to do. It doesn't want to not watch the TV. I don't know what you guys like to watch. I like to watch Grey's Anatomy. You guys can laugh if you want. So my brain wants to see it. The moment it stops seeing it is when my brain knows it needs to correct itself. That correction is how we train. Typically with ADHD, we'd be working on the frontals. The reason we work the frontals is because that's where most of the ADHD problems are occurring. The executive deficits, known as like motivation, categorization, organization, things of that nature. This will last 30 minutes. With this, there's glasses. The glasses are a they're kind of an additive. Some of my patients don't use the glasses for sensory reasons. Some of my patients don't use the glasses because they wear glasses and can't see without them. These glasses have two types of therapies. The first therapy is color. So blue, for instance, would be someone with anxiety. The blue helps calm them. It also takes away your peripherals so you're just focused on the TV. Second thing it does is, since you're seeing the color, it blinks and flashes. It flashes at certain frequencies. Those frequencies help with your brain frequencies. For instance, if we were working ADHD and we needed to raise the beta because the beta was low, the frequency would probably be at a 16, try to raise that slower 14 frequency. So now that I'm talking about the training and wearing glasses, I have one special patient here that doesn't wear the glasses, and she would love to talk to you guys. And that is Katie.
I had the worst self-image possible. I associated with garbage. I associated myself with a trash can. I would literally make self-deprecating jokes sometimes, which weren't even funny. So, that's the thing. But the point is, I had terrible anxiety. I couldn't stand most of the people in my class. And my ADHD caused me to make a lot of people not like me. I'm still pretty sure that a lot of people don't like me, but whatever, I don't care. So, when I first started this therapy, I was like, what is happening? I'm feeling worse, because my brain wasn't used to any of this nonsense, as my brain thought it was. My brain didn't understand it at all, and it was just like, abort. We don't know what we're doing. And after a while, I was like, hey, I'm actually feeling better. And when I first started this, I looked in the mirror. I saw a fat person, an ugly person, a person with a disgusting face that I didn't want to look at anymore.
But now what do you see, Katie?
I looked in the mirror a couple weeks ago. This made Stacey cry. This almost made my mom cry. My mom started tearing up. And I thought to myself, hey, I actually look good for once. Okay, when I first got my anxiety, and like when I was younger and I had ADHD, my coping mechanism was pulling out my hair.
Now how do you feel?
My coping mechanism is eating food.
Yeah.
I like bread mostly. Bread is the best.
But do you want to hurt yourself? Do you want to?
No.
No, you feel good?
Yeah.
How old are you, Katie?
I am 11 and a half.
Yeah.
Is school easier for you?
Yeah. So a thing with my old school, I hate the teachers. I still hate them, except for one, my second grade teacher. He was pretty chill, and he let me draw on my assignments with markers. Which, I mean, that's pretty cool if I do say so myself. When I first started it, my brain was confused. As I slowly went on learning this, I sort of started understanding it, and the screen wasn't like giving me almost like a, what is happening? Like a, that's kind of, what is that sound effect?
But now it's not like that.
Yeah, the screen actually flashes only a couple, 5 seconds maybe? I don't know. I don't time it, but I did fall asleep during one of the,
Yes.
during one of the
That's amazing.
Actually 4 of the neurofeedbacks. Because I was very tired,
But your brain was still training.
my
right?
brain was still training. Your brain does train through sleep. And if there are other people in the room, no, their brain is not training with you. It only works if you're touched out.
Yes.
Mom, do you want to talk?
I'm Liana, I'm Katie's mom, and
Hi.
my husband Keith and my daughter Allie. And I'm going to read kind of what my thoughts were about
Wait, you made
neurofeedback.
a journal?
When she says, guys, you started. When she says ouch, after she scrapes her knee instead of picking up a bike and throwing it. When she wants her sister to play with her hair instead of years of not wanting to be touched because of sensory issues. When she shows off her art sketchbook to her cousins instead of gluing together pages, ripping them out, throwing them away because she hated what she drew.
Am I spacing too hard?
Why didn't it read? When she smiles and tells you what she and her friends did at school, instead of crying every weekend and listing 37 names of kids that hated her. When she is happy in life, instead of crying in the bathroom to hide half the day. Something is working. So thank you, Liz and Matt, for introducing us to neurofeedback.
Thank you.
Now that you heard that, does anybody have any questions about the training process?
Does this work with actual therapy or as an alternative to therapy?
So this works without therapy. However, therapy is always recommended to go hand in hand with it. Some of my patients do like to talk to me. I ask the patient that first day, do you mind if I write things down? I've had 2 patients tell me I don't want you to write anything down we ever talk about. Everything that happens in that room stays between me and that patient. If I do write things down, the only other person that knows about it is the doctor I consult with in Arizona. That's the person who helps me with the map readings, and that is kind of the person who's my mentor and guide through this whole process to help you along. So if they were watching TV and they fell asleep, it still works because while you're sleeping, your brain's still moving. However, at that given moment, you're not getting the visual stimulus. You're only getting sound. The sound at this point is steady. However, the machine, and because the sensors are hooked up to you, it's still reading when your brain's going down and up, giving you that feedback.
So if it's going down, I mean, like if you're falling asleep, so like what does it do again in response? Is like the reward or like the negative?
So if you're awake and it's falling asleep, there's not going to be an audible response. The only time volume changes is when you are training eyes closed. When you're training eyes open, you get the flashing screen. So while you're falling asleep and your eyes are open, typically I'm there trying to wake you up to start. However, yesterday, like she said, she did fall asleep. I tried to wake her up, it wasn't happening. So at that point, after I tried so many times, I cut the session 5 minutes shorter because that extra 5 minutes, between 20 and 30, you're good. So at 25, I cut it. I let her sleep. Clearly, that's what her body needed at that moment. I wasn't going to overwork her. These sessions can manipulate 3 to 4 hours of intense studying. And I'm talking the library, quiet, no one's really around you, phones put away, no interruptions. So your brain does a lot of work in this 30-minute span. So this question for everybody here, I don't know if everybody did, was if 20, 40, 60 sessions, if you came and you completed your sessions, do you come back in for maintenance? A lot of people say no, I say yes. I say yes because it's like going to the gym. If you don't go for 3 months, you start to lose a little bit. So as Colleen described earlier, it's like a little tune-up. You can come in just for that one session once a month, just to keep yourself where you'd like to be.
It doesn't ever go back to the original.
Yeah, so this way here, it doesn't fall back. So through this process, because there's ups and downs, the down process is called the integrated phase. This phase is where your old habit is in a battle with the new habit we're trying to create. So what they do is the old habit acts out. So let's say you have ODD and you're defiant. Typically, during this integrated phase, that patient will overreact and be more aggressive than he was prior to this. That's because his old habit is trying to overcompensate the new habit trying to form. He's trying to push him out of the way and say, no, we don't want this new habit. That's why you come back in for the training 2, 3 more sessions while you're in this integrated phase. You're feeling down, all of a sudden you pop up, and that reaction doesn't occur again. Once you're out of the integrated phase, you've gone through about 3 to 5 sessions more is how we solidify and consolidate you to stay where you are.
For young children, you're saying this is, for anybody, it's a lot of brain activity. For young children, ones that they seem to fall asleep during this, is there any sort of like preparatory, you know, or you can do, or any sort of like recovery period you expect after each session? Because if it's really that taxing to their brain, especially children whose brains are firing so much, and especially when they might be on the spectrum or ADHD and they're constantly going, you expect them just to kind of knock out after the treatment? Is there,
So for young children, they need to eat protein-based diet, preferably before they came in. Your brain consumes 20% of your energy. And so if you eat, your brain already is taking 20% of that. The session, typically I don't have children fall asleep during it. As she said, her child does sometimes. He comes at 7 in the morning. Katie, my other one, she comes early in the morning before school. Now that school's over, it's a little easier for them. However, after the session, if they're feeling really tired for a couple days, it means that their brain kind of hasn't caught up to what's going on yet. But for 30 minutes, maybe an hour, you can feel tired. I do know that I've had patients, the moment we stop the session, take the glasses off, I turn everything off, I ask how they're feeling, they're like, wow, I'm worn out. 30 minutes to an hour later, typically their energy's back up and they're ready to keep on going through their day. And then
It only lasts like until you get used to it. Like I would say the first 4 or 5 sessions I was tired, but then after that, not at all. Like it's just until you get used to it.
And to go off that, you can come twice a day. It has to be about 4 hours apart. You have to eat a meal and make sure you drink water. PTSD. So if you have PTSD, the protocol we run for that's a little different. It's an intense protocol. You call it intense because typically when you're training for it, in the room, you can cry, you can hyperventilate, you can have a panic attack. That can occur in the room, and if it doesn't, you should expect it to happen when you get home or in your sleep. That happens because what we're targeting is the amygdala. We're sending frequencies straight to the amygdala. I like to call it Pandora's box because that's where your PTSD and emotion is stored. And we're trying to open that box and release all these emotions out of you. PTSD is like a chained dog. The dog can only go so far. And PTSD holds a lot of people back to that same standard. So releasing and opening up Pandora's box allows them to release those emotions and set themselves free of the PTSD. However, as I said, it is a very intense protocol, and all patients should be aware that you will cry, you can hyperventilate, but I stay in the room and I will be there with you and let you know that you're not wherever you think you are. Aside from PTSD, I'm going to talk about concussions. I'm going to talk about concussions for 2 reasons. One, because a concussion doesn't just mean it's a traumatic brain injury. You can get a concussion from simply hitting your head on a cabinet 4 or 5 times in a week. You can gain a minor concussion. With an EEG mapping, so for those of you who have children that play sports or if you're coaches, they do concussion-based tests before the season starts. However, this is a handwritten test. So if I was an athlete, why not just do terrible on the handwritten test so when I get a concussion and I take the test again to see if I have one, the score is the same. You can falsify those tests. In EEG mapping, you cannot falsify. Not being able to falsify this allows me, coaches, parents to know if this child truly has a concussion, or if they're lying, or if that test was false. So doing an EEG mapping, especially for athletes, is a great thing because then you do know, my kid got hit in the head, let's go get him mapped again. The concussion we'd see in high delta. So if that delta raises from the original map that this child, even adult, came and took, we know, okay, they do have a concussion. And typically, wherever you got hit, let's say you were playing baseball and got hit in the left side of your head while you were batting, that map will show high delta in the left side of your brain where you got hit. So for concussions, it's an absolute phenomenal thing. And with concussions, your brain technically has a bruise on it. It slows down the way it fires. Because of the slowing of the firing, it never really picks back up. With neurofeedback, it allows it to pick back up because of the stimulus it's presenting. Pre and post treatment for concussions is a little difficult. She, as was saying, she didn't remember those 2 weeks prior or before and after. Did those memories come back to you?
So the ones after, dude, it's kind of funny. So my concussion was about a week before Labor Day, and now I can actually and I don't know, it's because people have told me what we did, but now I'm like, oh yeah, we did that. But at the is still the 2 weeks prior to. I don't, and then I don't know, like if it's just something that's a short-term memory that just disappears, or I'm not sure. I don't know, but
No, but
I can
memories
tell
are-
you that every one of my symptoms has disappeared though. I don't have that anger and irritability. I don't have the headaches. I used to cry, like if you just looked at me, I would cry. So that is all gone. It's like a completely different thing. But like you said, your brain does bruise, so you have to wait until your brain swelling has gone down a little bit. So I don't know if I'll ever get the 2 weeks prior to the concussion back, but I'm good. Maybe I didn't need to remember that.
Memory stuff. Neurofeedback was founded by Barry Sturman. He's a UCLA research professor. He did tests on rabbits who had seizures. He tested 10 rabbits, what is called an SMR protocol. He got these rabbits to stop having seizures. I don't know if you guys know anything about research, but research with animals, there can be a placebo effect. The reason there can't be a placebo effect is because an animal doesn't understand that concept. So with that being said, NASA gave him a call and said, hey, our astronauts are in this rocket pod and they're having seizures the first 30 minutes because of the rocket fuel. We can't get them to do what we need. So he said, all right, I can give it a shot. Barry went and took his rabbits over to NASA, put all of his rabbits in this box, and they ran their little NASA test. As these rabbits started smelling the rocket fuel, he noticed that 10 of them didn't seize while the other 10 did. So after that hour, he pulled them out and he looked at the brains of these 10 rabbits. He noticed that these 10 were the 10 that he ran this SMR protocol on. He said, okay, now let's run this protocol on real life humans. So he ran. After about 60 sessions, because seizures is a little different than ADHD, he started to notice that these astronauts could stay in this rocket pod 30, an hour, 2 hours, 4 hours, finally long enough to be able to get their mission done while still smelling the fuel wherever they need to be. That's known as resiliency. So if your seizure threshold is right here, and in 30 minutes you hit that and have a seizure, what he essentially did was he brought this up here. 30 minutes, an hour, 2 hours, 3 hours. It took about 5-6 hours to finally hit the threshold for the seizure to occur. So it's kind of the same with everything else, anxiety, ADHD. Yes, we do a preview of some of those symptoms. However, what we also do is build that resiliency. So your anxiety level, for me, my first time here, I was super anxious the first time I ever did a seminar. It was probably right about here. Having a lot more confident in myself, that's what neurofeedback does. It raises that threshold for you. It gives you a lot more gray space to play around with before you hit your breaking point.
So you've used it on yourself?
I have done it on myself for my epilepsy, yes ma'am. Does anybody else have a question? Grab yourself a lovely beer from Black Dog and have a good rest of your night.
Thank you, Black Dog.